Hi all, I'm Dr. Neema Bhatt. I'm a bone marrow transplant physician for both adults and pediatrics. And I would like to take this opportunity to talk about what do you do post-transplant. So transplant is a complicated procedure where we use another donor. So it's called an allogenic transplant, where we use stem cells from a donor and after treating the patient, give these same stem cells to the patient so that their deceased bone marrow can be cured. Why is it important to take these precautions post a bone marrow transplant, and what are these precautions? Most often, for up to about 3 months to 6 months after a bone marrow transplant, the patient is immunocompromised, as in your immunity is very low, and it's important for you to make sure that you don't expose yourself to infections. Making sure to avoid crowded places, crowded marketplaces, or it can be places of worship, or having a lot of people, surrounding the transplant patient should be avoided because that can be one of the number one high risk for infection. Making sure to wear a mask whenever you step out in public places to reduce the risk of respiratory infections, making sure to consume food that is cooked in very clean and healthy places, and mostly consuming cooked food and not raw food so that you can prevent gut infections. Apart from this, being very aware of your symptoms. So, if you're feeling tired, you have a fever, make sure to reach back and contact your transplant physician or transplant specialist because a small infection, maybe a small fever or cold, for somebody else might be a big infection for a transplant patient. So, being very aware of your symptoms and reaching out to your transplant physician at the earliest possible can make sure that your infection does not go out of hand. It can be controlled at the right time. And in the end, make sure to take your medications. As a transplant physician, we do only about 50% of our job when we do the transplants. But if you don't take the medications according to our instructions and you're not stringently sticking to the medications, the transplant might sometimes fail. So, taking your medicines is as important as undergoing the transplant. If you have any more questions regarding bone marrow transplants, kindly feel free to reach out to a hematologist. Thank you.